Welcome, everyone. This is Steve Adams. I'm the CEO of Tiger Medical Institute, and welcome to the Tiger Optimal Health podcast. And with us today is Tiger Medical physician, Dr. Daniel Kessler. Daniel, welcome to the podcast.
Hi there. Thank you so much for having me.
Yeah, you're welcome. And I'll just give a quick overview. Dr. Kessler has been a physician, integrative physician for well over 2 decades. He grew up in Germany. He trained at Emory University Medical School. He trained also at the Mayo Clinic for several years, and he's been in private practice since then, and works with dozens and dozens of Tiger clients today. We're just thankful to have him. And today, we're going to talk about vascular health. Welcome, Daniel.
Thank you so much. Thank you so much. Yeah, I actually, went to Mayo, went to Emory for undergrad, and then at Nova did my medical school. And then what's really interesting today as we talk about vascular health, I'm sure we'll talk a little bit about toxins and the effect on the microvasculature.
Yeah. So let's just jump in, and can you explain the science of the glycocalyx in the microcapillary system, Daniel, first, just so people have a foundation?
Of course. Well, why we are really talking about this is that heart disease is still the #1 killer. And everybody knows that. In fact, my father died from heart issues, and many listeners have somebody they know who has been afflicted by heart disease. And when we think about the heart, then we also think about the arteries. And there's this network of arteries in our body that connects the blood flow, to the organs. Why is that so important? Because organs need proper nutrients, they need oxygen, and this has to be delivered. But when we look at the arteries, then the glycocalyx, the easiest way to imagine this is that if you have a garden hose representing an artery, then the inner lining of this hose, there is like a gel-like substance that protects this inner lining of the hose from stress and from damage.
Mm-hmm.
And what has been found, as we will talk about this today, is that there are many factors that can lead to the destruction of this gel, which then ultimately leads to damage to the arteries, which then is the first risk factor for heart disease.
Yeah. Wow, that's great. I like that analogy of the hose. And then there's the gel-like, and then the blood runs through the center, right? Yeah. So, if someone has a compromised glycocalyx, it's usually from things like stress and poor nutrition, just poor lifestyle habits in general, and aging, correct? I mean, is there anything else that damages that?
Yeah, unfortunately, we are not getting younger, and age is, of course, a huge risk factor. And then oftentimes we may not always be eating the way we should for whatever reason. Either we choose not to eat well, or maybe we have circumstances where we have no other choice.
Right.
Then what research has shown is that the nutrients that are so helpful to heal the inner lining of our arteries, food is always a big one. But what's interesting is that when we also look at other causes, then we also look at things like infections.
Yeah.
In fact, unfortunately, everybody knows about COVID, how much COVID had a role in, damaging the lining of the arteries and causing some heart problems and other problems.
Right.
And then other sources of infections can also come from our gut, because our gut has 80% of our immune system. So if we look at reasons why this can happen, then we always have to look at a very comprehensive approach.
Right. No, that makes sense. Um, one of the things I wanted to ask you about, and full disclosure, I'm involved in the company that makes this device, but can you explain to people that there is emerging technology that is actually going to be able to give people a way to measure where this protective gel-like lining is at in terms of health?
Yeah, and just to give the listeners a little bit background, so this research has been evolving over many years. In fact, also probably close to 15, 20 years. And why this gets developed is because we need to have new solutions. The current evaluations for heart disease oftentimes is limited to doing invasive procedures that are necessary to save lives.
Right.
But what I will tell you, I cannot tell you how many people I've seen over the years who came to the ER or came to my clinic and they had heart disease. They had no symptoms, they had normal cholesterol, and yet their arteries were so full with clots and blockages. And then the first question was, well, why did nobody know about this sooner?
Mm-hmm.
And that is why it's so exciting that now with the Glycocalyx Research Institute, that we now have tools, and we'll talk about it a little bit, how this works, that are non-invasive. In fact, you literally can be fully clothed in an office, in a room, and the device goes, under your tongue, and it can measure advanced biomarkers to give you a health score of your arteries within 10 to 15 minutes. I mean, that's really exciting. And when I looked at the studies that have been performed, remember, and I know you know this, but this device has been used all over the world,
right,
in many different continents.
Yeah, right.
In many different continents and hospitals and research centers. The reason why this is happening is because people are realizing we need to have new solutions. So that is why I'm very excited to help educate the world on this new innovative solution.
Yeah. Some of the facts are it's currently installed in 140 research and university systems around the world, including Oxford, Harvard, Duke, University of Michigan, University of Florida, just to name a few. Several
Mayo Clinic, yep.
Mayo Clinic, VA hospitals. It has 122 peer-reviewed papers published now since 2010. The science goes all the way back into the 1970s. Dr. Hans Vink is kind of the pioneer from the Netherlands, and he actually had a fellowship at University of Virginia under a gentleman there who was kind of viewed as the original pioneer in this space. But Dr. Vink took his work and actually proved that we had this organ that we didn't know about in 1996. And then since then, he's been validating the device since 96, working on a device and then validating it. And so, yeah, where we are today is people can get a vascular health score between 0 and 10. And the device, as proven by a 6-year study in Greece, they took 600 healthy individuals and they predicted accurately 91% of the people who would have a heart attack or a stroke 5 to 6 years in advance. That's the power of it for a clinician like you, because the scores correlate to a risk profile. And so it's been exciting. So one of the exciting developments is the same team has developed a nutraceutical. They reverse engineered what were the factors, what were the components of the glycocalyx, and can we go out into nature and find similar things that will reconstitute it? And they have, and it's in a supplement, and it's early. We don't have the same number of studies and clinical trials, but the scores go up, so we know it works. Daniel, can you talk about that a little bit? The brand name is called Revasca, and why would somebody want to take that after they get their score?
Yeah. So in my career, and I've been now a physician 22 years as of this recording, I have been trained extensively in traditional medicine, did my studies at Mayo, Emory, we mentioned that.
Yep.
And I also used to work in cardiology. I was actually working in the cardiology clinic here in Jacksonville, Florida for a good 4 or 5 years. Mm-hmm. And what was discovered through traditional training and integrative training, that there are so many causes that can lead to the damage of the lining of arteries. However, what's important is that there are three ways only that the artery can respond. The artery can respond with inflammation.
Yep.
The artery can respond with immune system dysfunction. And the artery can respond with what is referred to as oxidative stress.
Mm-hmm.
So inflammation, immune system dysfunction, and oxidative stress. If anybody ever has lived at the beach, you can know that structures at the beach, they start to rust.
Yes.
You park your car outside, for example, like my car is already at the beach, close to the beach, getting rusted. The oxidative stress is like rusting.
Yeah.
And we have nowadays the ability to measure and prove without a doubt that this is present in the body.
Mm.
Now, since this is true, what are traditional solutions with your doctor? Well, take a statin.
Yep.
Statins also have been found to help with immune system dysfunction and even inflammation. But to go further, I know that there are many patients who are listening to this, or many people listening, they don't like to be on medicines.
Right.
And maybe you have people that have normal cholesterol. So should these people be on a statin? The answer is we don't know. But what we do know is that is why Revasca, for example, was developed, again, over a long time period. It has evolved over the last 15 plus years to also include solutions that address inflammation, immune system dysfunction, and oxidative stress. So all of the ingredients cover those three parameters.
That's excellent. And what we talk about is it's not enough for many people to take a supplement alone, because if you continue in your lifestyle habits that are destroying your glycocalyx, the supplement is only going to fight that.
Right.
And especially as one gets 50 plus and has metabolic syndrome, it's more acute. Talk about, like what we do at Tiger Medical and how lifestyle medicine can synergize with a Revasca and really transform your vascular health and really rewrite a new narrative on what your health profile can look like into your 80s.
Yeah, absolutely. I think that if we think about new solutions, then we have to think about that our body is connected, and our body is connected via the circulation. The circulation, the arteries, the little capillaries, the little arteries are called capillaries. That is where nutritional exchange takes place.
Mm-hmm.
And, you and I know, because we work with clients, at Tiger, that many times, we have had patients, they've been on 3, 4, 5 blood pressure medicines because the stress that they have experienced in their blood vessels are so high, the pressure is so high because the lining is so inflamed.
Mm-hmm.
And then I remember one patient, for example, he is 68, and he told me he has not had a vegetable in more than 40 years. Now, this is very extreme. But this was a gentleman, he was on 4 blood pressure medicines. Within 4 months, he has been off all 4 blood pressure medicines, and his blood pressure is 116/80, with the addition of lifestyle plus the supplements we had mentioned.
Wow, that's impressive.
Yeah. But before you ask me next question, I want to make sure the listeners understand that supplements do not treat or cure any disease, any condition. It is just that nowadays we have identified natural solutions that are good for inflammation and especially for oxidative stress. So that's where Revasca really, really shines.
Yeah. I think another thing that you might want to tie into this conversation, because it relates to oxidative stress, especially, is the presence of toxins. You want to jump in there, Daniel?
Yeah. So fortunately, I was one of the lucky ones to work at the Centers for Disease Control and Prevention. in Atlanta, Georgia. And my role specifically, I worked at the National Center for Environmental Health. And my role was to analyze people's blood for toxins. And the sad thing is, everybody has them. These toxins are man-made toxins, things like heavy metals. We also think about pesticides, and they're just ubiquitous in our environment. And what's interesting is, just recently, a few months ago, there was a major article that was published in the New England Journal of Medicine, where they discovered that plastic remnants have been discovered in the lining of the arteries.
Wow.
So this is now, I mean, many doctors have known this, but now there are more and more studies coming out. So, and if you think about the analogy of a garden hose, if you're out there in your garden watering your flowers and you think that maybe the stream is not strong enough, there's a kink or something, then what we do at Tiger is we find the kinks and we say, what is causing the obstruction, the inflammation inside the hose?
Yeah.
And by doing that with a glycocheck score, we can see what the score is for a person. Once this is done, then you sit down with the patient and you have a conversation and you say, how is your lifestyle? How is your diet? Where do you want to start? So that's sort of how those conversations go.
Well, and the whole idea is the things that we work with people in lifestyle are we teach them how to create a new relationship with stress, meaning through our breathing program, we help them disarm their stress response on demand. We teach them how to sleep well. We get them fasting in an eating window. We have them move their body every day, optimize the input and the fuel in their body, which is fuel. We get them to meditate. We support them with supplementation. There's one more. I always forget. I always get 7 out of 8, and it's a different one every single time. Oh, hydration, hydrating the body. And it sounds like simple, like are you kidding me kind of things. But when you synergize all of that with working with someone like Dr. Kessler, who's trained in integrative medicine, meaning both root cause and traditional standard of care medicine, who can look at where you are today, understand the truth about you today, understand genetically how you're built and made. When you take that all together, it's like a 3D prism of health that can be restored. And so what the glycocheck, the test under your tongue, is just, it's giving you a data point. And then 3 or 4 or 6 months later, you can see, am I getting better or not? And, I'll give you an example of my family. Daniel, you know this. My dad's had 9 heart attacks. He had a stroke. He's had colon cancer. He's had prostate cancer. It's quite the hall of fame of metabolic disease. And when I turned 53, I sold my last business to get into the health business because I wanted to do better. And now I'm 60, almost 61, and my dad had 2 going on his 3rd heart attack by then. And I have no blockage because I did a Clearly scan. And I have really good lipid markers. But yet I found out I have a low normal vascular score, which makes sense because of my genetics and family history. I'm set up to fail in that area. So now it helped me go to that next level of commitment on my lifestyle. Plus I'm on Revasca myself. So I'm trying to do everything I can and not bring any more assaults on my body. I'm trying to minimize the assaults and maximize the therapies.
Yeah, one of the things is that, so I think to summarize, I like to be very scientific. I know that some listeners, they may say, oh, here we go, here's another supplement. But remember, what's really important for listeners is that this is technology that has evolved and is used in over 140 centers all over the world, with studies like the one you mentioned from Greece.
Yeah.
And what's really interesting is that if we go back one more time to the garden hose analogy, then if the listener pictures a part of the hose from left to right, then it takes something to start the injury. It's like a little scratch. It's like, if you have a scratch on your skin, you start bleeding, you heal very quickly if your immune system is strong. But imagine that, some people out there may have diabetes, or they may have prediabetes, or they may have some kidney problems, and maybe there's somebody out there who's still suffering from concerns about COVID and long COVID. And
Yep.
all of these things leads to the scratching and the damage of the inner lining. And then there's this perpetual cycle if nothing changes, if we don't put in those 8 factors, those lifestyle factors, then bad things are going to happen. And you mentioned, I know this is about glycocheck, but you mentioned clearly, so glycocheck is a solution for the small arteries,
Yep.
the microcapillaries, and then there's emerging technology for the large arteries. And what we're really trying to do is not just work with clients, but Steve, I know we are also educating other doctors and
Right.
showing them, hey, you can have all these solutions in your office, help people actually prevent heart disease and strokes early,
Yep.
so that just like you are doing so well, we don't have we don't have to say my genes are my destiny,
Right.
because we know that's not the case, right? Genetics plays a role, but it's our daily choices, our daily commitment to our lifestyle, plus these new solutions, that is really exciting where we're headed.
Thank you. And it's not, at Tiger Medical, we're not trying to sell living to 150. What we're trying to sell or educate on is you don't have to accept cultural norms around aging. You can
Yeah.
have, functioning joints and have energy and be optimistic and take on new challenges in your 60s, 70s, even 80s. That's what we're trying to help people with, because I have a nonprofit. We have a goal of lifting up 1 million entrepreneurs around the world in the next 10 years. There are 1 million other people out there with similar visions of some kind of impact on society. And if we can help them show up as the best version of themselves, think about the impact on the world, as everybody is able to do that. But when you're tired and sick, you can't live out those visions, because you get very concerned about yourself. Any last comments, Daniel, before we conclude?
Yeah, I think the last comment here is also that I'm sure you're going to include some contact information for people
Yes.
that are interested
Mhm.
to learn more. And then that a lot of these solutions are also, they're not going to break the wallet. I think that's really
Right.
important,
Right.
because the reason that we're really doing this is the why behind it. My father died from heart disease last year. Your dad, had some unfortunate events. So I did my own tests. I had some things, that I found early and that I'm now, remediating.
Addressing. Yeah. Yeah.
So the listener, I want to give the listener hope
Yeah.
that if somebody says, listen, there's nothing else we can do, then, reach out and get your score, and you'd be amazed what can be achieved. Just like that guy that came off of 4 blood pressure
Yeah.
medicines within
Exactly.
a couple of months. Yeah, exactly.
You have 10 more stories like that, by the way, too. It's not just him. Yeah.
Maybe 11. Maybe
Yeah.
11.
Yeah. Well, with our other doctor, we added up, it's a
Sure,
lot. Yeah.
sure.
Yeah.
Yeah,
So
but
what you do is, if you are interested in getting one of these vascular scores, the first one that's going to be placed in an actual store in America is at my store called Nassau Health Foods in Amelia Island, Florida. If you just go to nassauhealthfood.com and notice at the end it's food, not foods. It's a singular. So Nassau, Nassau, healthfood.com. And you can call the store and ask if you can sign up to get a glycocheck vascular health score. But if you'd like to work with Dr. Kessler or learn more, go to our Tiger website. It's simple. It's just Tiger MI, like Michigan, MI, tigermi.com, and request a call, or go to the contact page and reach out, and my assistant will get to me and we'll talk, and I can explain how you can work with Dr. Kessler. Thank you, Dr. Kessler.
Thank you, Steve. Thank you for today.
Steve Adams here from Tiger Medical Institute, talking about the True Health Assessment. What if you could safeguard not just your health, but the well-being of your entire family? With the True Health Assessment from Tiger Medical, you can. Our comprehensive blood screening identifies hidden risks before they become major issues. Our elite team of Mayo Clinic trained and naturopathic physicians then create a customized plan to optimize your health for years to come. When you prioritize your wellness, you ensure you can be fully present for the people you love most. Don't let preventable issues cut that time short. For less than the cost of a daily latte, you can gain peace of mind and a clear path to sustained vitality. Protect your future and your family's future with True Health Assessment from Tiger Medical at thetruehealthassessment.com. Again, that's at thetruehealthassessment.com.